Vaccines are going to bring an end to the COVID pandemic. An exclusive News Channel 5 investigation discovers Tennessee may have a lot farther to go than most states.
That's right, Vicki. News Channel 5 Chief Investigative Reporter Phil Williams crunched the latest data from the CDC, and it reveals that when it comes to people volunteering for the vaccine, the volunteer state has some of the worst records in the country. Phil.
All of the experts say our best hope for getting completely back to normal is for a majority of Tennesseans to get a COVID vaccine. But take a look at what we discovered. Tennessee ranks 48th among the 50 states in the percentage of adults fully vaccinated, 48th in the percentage of adults who've received at least one dose, and 45th in the percentage of seniors aged 65 and older now vaccinated. To try to understand what's happening, we headed to a county in southern Middle Tennessee that, according to the CDC, has the worst vaccination rates in the state.
We're one of the smallest land-wise and population-wise.
Lynchburg-Moore County, the home of the Jack Daniels Distillery, prides itself on its small-town charm. But many days nowhere is more quiet than Moore County's COVID-19 vaccination site. We watched for an hour and spotted just a handful of cars. It was incredibly quiet there.
It was while you were there. This morning while I was there, they were backed up to the road.
We caught up with County Mayor Bonnie Lewis the same morning she got her second dose of the Moderna vaccine.
As of right now, we have given vaccines in this county over 4,400.
How many of those were Moore County residents?
That we don't know.
We had to go to Winchester for our first shot, and then we had to book the second shot here.
But we saw mostly people from other counties, even from other states. According to CDC data, Tennessee ranks 48th in the country in the percentage of adults now fully vaccinated, with 23.4%. Of Tennessee's 95 counties, the CDC says Moore County is dead last, with just 10.5% fully cleared.
Well, my first reaction is no. I don't feel that. I don't agree with that. Because I know of our efforts.
Mayor Lewis questioned the numbers, noting that Moore County shares zip codes with several neighboring counties. Still, she admits there are skeptics.
You know, was there enough research done? Is it going to alter my DNA? But then there's also some people that they don't want 2 appointments for anything. They're going to wait for the Johnson & Johnson and, get their one shot and go.
That was before the pause on the J&J vaccine.
In the South, people are a little leery of government in general.
Tommy Lowe came from neighboring Franklin County to get his shot.
Some people just don't trust it. Everything I've seen, I trust it. It's like I said, it's not availability, because it's easy to come get.
Some tend to view this through a political perspective. After all, Moore County is a heavily Republican county. But here in Williamson County, also heavily Republican, you'll find some of the best vaccination rates in the state.
The eager beavers are still coming out, those first acceptors, but particularly in our rural areas, and we have a lot of people living in rural areas, there are people who are not coming forward for vaccination.
Dr. William Schaffner, an infectious disease expert from Vanderbilt, worries that in rural areas, misinformation is hampering vaccination efforts. The solution?
The first 3 answers are leadership, leadership, and leadership. I think we need our political leaders, both at the state and the local level, to make unequivocal statements that everyone should be vaccinated. Everyone.
Certainly, we want as many Tennesseans to get the vaccine as we can.
Tennessee Governor Bill Lee has spoken about the need for vaccinations, but while other governors have chosen to lead very publicly by example, Lee has said he got vaccinated, but he did so in private.
Telling you the facts and helping share the facts and the availability is probably the best I can do for you as a leader, but it's not my job to talk you into it.
Mayor Lewis says while she has led by example, she also did not believe it was her job to impose a mask mandate, nor to aggressively push vaccines on her residents. So if people believe something that's not true, you don't think it's your job to try to convince them of the science?
I've shared the science, but as far as convince, I'm not going to go out of my way to prove you wrong, okay? Yeah, that's not my job.
Still, while other states and communities are responding more aggressively to calls for vaccinations, Dr. Scheffner worries about those who fail to heed the medical community's best advice.
Across the state of Tennessee, if we can't get these numbers up, we will have patches of our population that are well vaccinated. They'll be relatively spared. But in the under-vaccinated part, this virus will live on. It will keep being transmitted and take neighbors and friends and family members and put them in the hospital.
Our neighbors to the north in Kentucky are also doing much better in getting their people vaccinated. Kentucky is about middle of the pack on most of the numbers. As for me, I'm proud to say that as of yesterday, I am now officially considered fully vaccinated.